We cannot sit just here.
Yesterday, I received a phone call from Honorable Rachel Nyamai, the MP for Kitui South, who informed me about the concerns that she had after she received some information from some of her members in their constituency about a case, suspected case of coronavirus in Mutomo. This is from one of the contractors, the Chinese workers who are working with the Sinhydro, which is a company currently constructing Kibwezi-Kitui Road. After we received this information, I immediately dispatched a team of healthcare workers to go and get the correct information. We were unable to access the site where the construction site where the person who was suspected to have the virus is staying, and so we agreed and arranged that my team was to visit them this afternoon, this morning. So I've just talked to the sub-county medical officer of health, Dr. Paul Kibati, that they have at last been able to go with the DCI in Kitui South, and they visited the site where this person, the suspected person, is staying. They have they have evaluated the patient. The symptoms, as we have all aware, is you look for the symptoms of fever, whether the patient has high temperatures, whether the patient is coughing, whether the patient is having difficulties in breathing. These are the main things that most of the patients who have coronavirus will be presenting with. My team has gone, led by Dr. Kibati, and they have checked for that. They took the temperatures for this suspected person, and they found that the person had normal temperatures, and he didn't have any other indicative symptoms to show that he has the coronavirus. And so my appeal to the members of the community is that they need to be calm. They only need to be careful when they're interacting, especially with people who have come from the hotspots, as we are all aware that China has reported quite a number of these cases. And if you suspect anybody who is living in the community and you suspect that they could be having infection, it is important that you notify the Ministry of Health, and we will urgently take immediate measures to make sure that the cases are screened to prevent any possibility of spread of the disease. I have been in touch with Acting Director General Dr. Patrick Amo from the Ministry of Health. He has dispatched a team led by Dr. Daniel Langat, the head of disease surveillance in the Ministry of Health, to come to Kitui, and especially to bring protective equipment, protective gears, so that our people, as they supervise, because I also have been made to understand that we have another team from arriving in the next few days from China, and we have agreed with the Chief Engineer, Mr. Zeng, that any person who is arriving from China, they have to keep track of when they are arriving, when they are, who is going to pick them from the airport, where they will be staying for the next 14 days, because the incubation period for the coronavirus is about 14 days. And we need to monitor the progress of these people as they arrive up to the end of the 14 days, so that we can make sure that our people are safe, especially the community that is working with them.
I want to clarify as follows. Okay, the first issue is the report in the Star. Okay, it is based on the long and false information. The information the project is operated by us, Sinhydro, and one of our Chinese staff, not 18, okay, just one of our Chinese staff coming back from China, is isolated in Motomo campsite. And nobody of this company entered Kenya at 3 a.m. on 17th February 2020. Number two is the mentioned staff arrived at Jomo Kenyatta Airport. He left the airport by official and right procedure of entering, and then arrived at Motomo campsite at 7 p.m. to be isolated. He was from Hebei province, not Wuhan city. As requested by the Chinese embassy and in Kenya and our company headquarters, all the Chinese staff isolated at Motomo campsite must wear face masks and have no contact with others for the sake of public health. The company will not send any Wuhan staff aboard before that disease is completely controlled. Okay, and we are welcome the Minister of Health office to send their officers to help us for monitoring the isolated staff, and we will keep close communication with the office for any assistance. For the last, any samples similar or abnormal situation will be reported to the Minister of Health office and the Chinese embassy immediately and following the right procedure.